As you're talking to healthcare providers and about AI solutions, how receptive are they? Because one belief is that these solutions are going to replace people. How receptive are clinicians?
There was this famous saying from 6 years ago by this guy named Jeff Hinton who said, all the radiologists in the world will be replaced by AI. And in fact, what has happened is that the pure amount of data and the number of MRIs and CT studies has tripled over the past 6 years. The number of radiologists has actually decreased, not because AI has replaced them, but because medical school students just haven't been turning them out as many. And so what you now have is situations where radiologists are way overworked. So the conversation is not about, is it going to replace me? It's like, my gosh, where's the help, right? I need the help. The idea that I could possibly spend and look at thousands of CT scans to look for tiniest little dot that could possibly be cancer or possibly be some sort of glioblastoma or whatever, it's scary. They really want AI tools that help, that solve the really, the things that are should be quick and easy and help them understand that and get through them. The hard things, they're doctors, they'll work on. The same with pathologists. We were just trying to think about, hey, instead of counting cells on a slide, spend an hour and count the blue cells versus the brown cells. Like, let AI do that. Like, AI can do that. It takes 10 seconds.
This is Genetics for Healthcare, a podcast for patients.
Thank you for tuning in to Genetics for Healthcare, a podcast dedicated to helping patients and their caregivers advocate for a precision medicine approach to treatment, disease screening, and disease prevention. You can find us on Spotify, Apple Podcasts, YouTube, LinkedIn, Facebook, and Instagram. While you're at it, hit that subscribe button, especially on YouTube, to get alerts and updates on new episodes like this one. Today we are, I'm just excited to have Andy Moye, PhD, Senior Vice President and General Manager of Data Products for Tempest AI, to help us better understand the exponential growth of artificial intelligence and how it can be used to improve our healthcare, particularly in the area of genetics. Andy, thank you for being a guest on Genetics for Healthcare.
Rome, it's a pleasure. I appreciate the opportunity.
Now, I'll spoil for our listeners out there. I'll steal the lead here. Like, Andy's a longtime friend in the industry. I've known him for quite a bit, and I've had the pleasure to be his friend and colleague, and just watch you ascend in the industry. Most recently, you were the CEO of an innovative company that developed the first FDA-approved AI product for digital pathology. You've got your PhD in health economics, for goodness sakes. But you started out your life's journey as a soldier. So off the top, I want to say thank you
Yeah.
for your service. But like, how in the world does a soldier get to be CEO, creating
Yeah.
AI products? Tell us
Yeah.
how you got here.
Yeah. No, man, it's been a real pleasure to know you as well it's been too many years. I won't say the number. All right.
Yeah,
So we'll,
please
we'll
don't.
leave
Yeah,
it.
these gray hairs are
A
these
long
gray
time.
hairs are well earned.
For sure, for sure. But it's really just about service, man. When I got out of college, just making money for making money's sake never really appealed to me. Maybe that's just miswiring or something. But I really just wanted to help people. I really just wanted to do things that mattered. I wanted to do things that had purpose. The military allowed me to do that, for a period of time, and got a ton out of it. Leadership skills and a lot of really cool stuff that I think people miss out on in hiring veterans. But as I got out of the military, it's really like, what's next for me? How do I continue to serve, but help my family and do, as they say, do well by doing good. And got into this crazy space of diagnostics. I'm sure we'll talk about it, and precision health and in genetics, and probably at the right time. You've known over the last couple of decades how much it's exploded, and now with AI, which I'm sure we'll talk about, and sort of this next paradigm. And so it's been really a cool wave to be on, as part of this whole journey, and just continuing to help people. I think if you always have that bent, like, hey, I'm just here to serve the patients, that ultimately our technologies or our tests or our services help. You keep those folks in mind, you'll never go wrong. So that's kind of been my guiding light throughout this whole journey.
Absolutely. I'm going to come back on a little something there, but I want to get into this conversation because as we were just talking about, like we can talk about this forever. So
Yeah,
um,
yeah,
let me ask you the most simple, basic question: what the heck
yeah.
is AI? Okay.
Yeah. Look, I mean, it's been, I think prior to ChatGPT, people wouldn't have a clue, and certainly wouldn't be impacting their daily life now like it is everybody's daily life. And the easiest way to think about AI, and it's certainly been around a long time, and it's, machine learning. People talk about these are all kinds of terms that get thrown around about foundation models and generative AI and AGI and things like this. But at the heart of AI is simply very, very complex pattern matching done by a computer. That's it, right? So you're able to train a computer system to learn something and then make a prediction about something. It's kind of like you teach your kid, the ABCs, and then you give them a test. Like, is this an apple? What letter does apple start with?
Yeah.
And so if they get that right, they're learning, and you can rely on them to sort of get that right every time. AI is no different, particularly in healthcare AI, which we kind of call deterministic AI, though a lot of the large language models and stuff have really started to shape some things, and generative AI has really started to shape some things. But it's really what it is. We think about, can a computer match a pattern, particularly a diagnostic pattern or an outcomes pattern, in order to help a doctor and help a patient get the best therapy possible, right? And that's really all it is. We can dive real deep in all the machine learning stuff and the engineering and the coding and all that stuff, but at the end of the day, really complex pattern matching is all it does. It's what Amazon does when you go and you search for shoes. Suddenly you're getting fed ads for Nikes. It's the same sort of thing. We've matched a pattern. You like shoes.
Yeah.
Really not any more complicated than that.
Well, I appreciate you breaking it down like
Yeah,
at a very fundamental level. Um, but when you're creating products
yeah,
for healthcare, right?
yep, yep,
And you just mentioned with like machine learning, you have to have a base set of information that you're training that machine
right,
learning. So like, how can we be confident? And I guess what are the requirements
yeah,
if you're creating this type of product
yeah,
for a healthcare application? Like what kind of
yeah.
training set do you actually need and how can people trust it?
So to stick with the very simple analogy, if I train my 3 or 4 year old on Russian alphabet, and then try to get them to tell me what letter Apple starts with, you're not going to get the A that you're expecting to come out, right? That's because that's the data set it was, he or she was trained on, right? And so the machine is no different, right? It learns from the data sets that we provide it. And if we think, very, very simple, um, application here of cancer detection, right? Maybe even something on a radiology image. So if you go and you get an X-ray, you get a CT scan for your lungs, can something predict, or a mammogram, maybe to use that analogy. So you go, woman goes to get a mammogram, and what happens is those images are looked at by a doctor. The doctor's been trained to know the difference between, a slightly opaque, dot in the screen from a slightly less opaque, what is cancer and what is not. You take all of those mammograms, and if you take millions of those mammogram images and you show it to a computer, and you tell the computer, hey, these ones were cancer and these ones weren't cancer, over time that AI is really going to understand the difference. It's going to know, well, this very, very subtle difference in opacity for what I'm seeing on the image, that equals breast cancer or something to be concerned with. These things maybe not, right? Those kind of things. And so the data is critical in clinical healthcare AI. You really have to ensure it's not just what you're training it on, but it's also what we call the ground truth. So what that means is like the same sort of concept here in the mammogram. If the ground truth, if it says, hey, I think this is cancer, you have to know that it was actually cancer, down range. So you have to train that algorithm to be right, to learn. Right? If it's learning the wrong things, it's gonna predict the wrong things. So the ground truth of what the data is, and then the actual data itself, really drives what we call the sensitivity and specificity of these tests, meaning how accurate are they and how often do they give you either false positives or false negatives. That's all dependent on the data they're trained on.
Yeah. And when you talk about that data set for healthcare, it's not just pattern recognition for
Right.
genetic sequences. I mean, we're talking about, as you just mentioned, screening, looking at
Yeah.
pictures. So there's
Yeah.
digital images or clinical imaging
Yeah.
files. There's the clinical data itself, like how did
Yeah.
patients respond when given certain
Yep.
therapies. Can you talk
Yep.
more about like how robust the data is when you're
Yeah.
thinking about like creating use cases for them? Like what goes into it?
Yeah, you start to get into this concept of what we call multimodal data, right? This is a very hot word in AI and clinical healthcare AI. So, multimodal just simply means lots of different things. If I have an image, that's one mode, one modality of data, but then I add, to your point, clinical records. So I can think about, did this patient have a history of cancer in the family? So that increases probably the probability of the AI to say, hey, that's probably cancer. Did the patient have a BRCA mutation? Right. So now you learn that from genomics. That's yet another modality, right? So we have the clinical record, we have the history of the patient, we have genomics, now genetics that are involved in that. The more the AI can factor into its prediction, the more likely it's going to be very much more accurate about it, right? Versus just saying, okay, here was an image of a mammogram, and yes, that was cancer. Okay, it's probably going to get pretty good. But again, if you're adding genetics, you're adding clinical data, maybe you're adding some other genomic sequencing, other histories, blood pressures, other medicate. Like there's a lot of factors that could go in that the AI can take into account to improve the accuracy. Again, this is really all about how well can that AI make that prediction. And what you see too in these sort of predictive models is that they very much improve the ability for the human, for the doctor, to not miss stuff, right? Which is really what matters most right now. We really want to be sure that these models are allowing doctors who are overstressed, overworked, particularly radiologists, pathologists, these diagnosticians, to not miss cancer on a mammogram, right? I think if any of us has, wife, mother, daughter, sister, whatever, you go get that mammogram, you want to be sure it gets caught early. The earlier the detection, the better your outcomes. So that's really what these models are for.
Yeah. And just like those experts that you were talking about, we trust them because they have years and years of
Yeah,
experience, doing
yeah,
this day in, day out, seeing thousands of
yeah,
patients. But likewise, our the machine learning is based on thousands upon thousands of patients with
yeah,
real world, cases, response from therapy tracked over a period of time. And I
yeah,
think, the promise is hopefully AI doesn't get tired or have a bad day, because we've
yeah,
all been there,
yeah,
right? So,
yeah,
is that
yeah,
the promise of AI? And like you said, pattern recognition, the human eyes is the same
yeah,
thing, whether we're talking about, Gleason scores or looking
right,
at tissue on a slide. Well,
yeah,
these
yeah,
humans are recognizing patterns, but
yeah,
um,
yeah.
we're assuming AI can be much better and over the long
Yeah,
haul.
it, and we all love our, you and I, we worked with medical doctors, for many years, and they all work their tails off, but they're human beings. Yeah, at the end of the day, man, like you said, people, have a baby at home, get 2 hours of sleep, have to go in and try to make a diagnosis on 20 really complex cancer cases. Chances are you might miss one. I mean, there was an article published in the Wall Street Journal about a year and a half ago by an oncologist down at University of Miami, and he basically said, about 20% of the diagnosis that patients come to us who already had a diagnosis from somewhere else, we had to change that diagnosis when they got here. It's basically saying, 1 out of 5 patients got an initial diagnosis that wasn't right
Mm.
in some way, or wasn't completely accurate. And you may have been like, it's not cancer or not cancer, maybe like how bad was that cancer? Or what was the classifier of that cancer? What was the prognosis of that cancer? So there's a lot that goes into it. It's not black and white. I think most of the general public thinks that, like you go to the doctor, they took a skin biopsy because something looked bad. 3 weeks later, it's melanoma or it's not. It's really not that simple. There's a lot that goes into the diagnosis of a cancer, depending on what it is. Some are really easy to spot, some are really difficult. And to your point about Gleason grades, for folks who don't know what that is, for men, when in prostate cancer, there's an old saying that, you probably won't die of prostate cancer. You'll probably die with prostate cancer. Prostate cancer is a terrible disease, but it's very, very survivable from a big general population perspective. But if you go and you have a biopsy of the prostate and you find prostate cancer, they do this thing called Gleason score. And a Gleason score was invented by a doctor over 50 years ago. It's sort of like, how bad do these cells look? How many of them are there? That's stuff that doctors, very subjective. And if you get a score of like 8, they may recommend, radical prostatectomy, maybe take out that whole prostate. It's very painful, a lot of comorbidities associated with it. If it's a score of 6, they may say to you, do nothing, do absolutely nothing, just come back in a year and we'll check it out. It's just a very, very different outcomes to base on very, very subjective criteria. And I think patients deserve better. I think we're in an era now, AI, I mean, the AI that you talked about earlier at Page, we had an AI, it's FDA approved to detect cancers in prostate, but also give you a Gleason score that was objective and at least was based on the same thing every time, never got tired, those kind of things, and should lead to better outcomes for patients.
Yeah. Historically, the introduction of like technology that has the potential to be transformative, right, has is met with a lot of fear and reasonable skepticism. I got to admit, I'm one of those people. Like, it took me forever to get a Facebook account. So
Yeah.
I came across a book recently that was written by Reid Hoffman, who is the co-founder of LinkedIn. It's called
Yeah.
Super Agency. Not sure if you're familiar. I know you're a voracious reader also.
Yeah.
The book is Super Agency: What Could Possibly Go Wrong? Excuse me. What could possibly go right with our
Yeah.
AI future?
Yeah.
And so he
Yeah.
talks about like how the telephone, when it was first introduced, that many in
Yeah.
society believed that it would be a threat to in-person relationships, right? Social
Yeah.
media,
Interesting. Yeah.
again, like
Yeah.
I didn't care if people knew where I was and what I was eating, you know.
Right.
But today I realize it's a great way to build, your network,
Yeah.
grow your
Yeah.
influence, stay in touch with a broader, your broader network.
Yeah.
And I still don't care, but I'm what I'm
Yeah.
eating, but I'm posting selfies and
Yeah.
food anyway, right? Um, but I say that because like he rejects the pessimism of some
Yeah.
people like me as I started out, but he also doesn't subscribe to the gung ho, champions that want the complete freedom to innovate and in this
Yeah.
instance deploy AI solutions.
Yeah.
He suggests, caution and say, let's do an iterative development to get these applications in the market in bite-sized increments where we can learn and grow
Yeah.
with the technology versus something
Yeah.
that scares people, and then you almost smother innovation because you have to regulate it
Yeah.
as a result of people's worst fears. Where are you at on this sliding scale of enthusiasts?
Interesting. I mean, a lot to unpack there. I think the first thing, what's interesting, and he's exactly right, is if you think about um, as a species, right, human beings, we're very tolerant of human error. And so 50,000 people a day crash their car, right, for a variety of reasons, distracted, look at the phone, whatever. But the first self-driving Tesla or Uber that runs into a stoplight, people lose their minds, right? They're like, oh my God, we got to get them off the street, they're
That's right.
going to kill everybody, this is the most dangerous thing ever. It's the same thing in healthcare, right? We're very, as human beings, empathetic to other human beings and mistakes because we're all mistake prone. And so we get that. We have very less tolerance for machines. I'll give you an example. The Page, algorithm was very well studied for prostate cancer, for detecting cancer. And the sensitivity was something like 99.9%, okay, which means that 1 out of 1,000 times it's going to miss something that was there, that was cancer, right? So that's the number. 1 out of 1,000 times. Well, sure enough, we'd have doctors who would use it, and that 1 out of 1,000 would come up early, in the first 100 or a couple hundred cases, and they would say, "You missed it. You missed it, and I can't trust it, and I'm never going to use this again, kind of thing. But the opposite of that is, if you think about a doctor doing it by themselves, they may miss 1 out of 5 or 1 out of 10 diagnosis. And so, like, the challenge is that I think people expect perfection from these AI algorithms, and you're never going to get perfection. You're never going to get perfect predictive models, but they're certainly going to make us better. And so it's about that trade-off of using these as tools to be part of, to make progress, right? If I can reduce my human error from 1 out of 10 to 1 out of 1,000, I sure as heck will sleep better at night as a doctor.
Yeah.
Right. I try to tell this to doctors, and they're like, wow, but and it's like, yeah, but come on, right? This is kind of how you have to work with the AI. And so I agree with Reed from the perspective of, like, you just can't, because the challenge is it's going to be very, very, almost anyone can build an AI model. They really have to be, when you're talking about clinical decisions for patient that may ultimately impact their life or their ability, their quality of life, their ability to do things. It's got to be right. The data sets have to be right. The doctors do have to understand the validity of these things. And so I do think there's a balance here. It can't be all in and everybody is just build whatever you want and get them out there. But it also can't be so smothered where we're never going to get to a place where these really life-saving innovations should and could be used in hospitals and health systems today. And so I get frustrated because I feel like there's a world where someone may throw something at me at some point, but, like, it's almost malpractice. Like, you think about it as a patient, if I knew there was a tool that only missed my prostate cancer 1 out of 1,000 times, and the doctor wasn't using it, like, why didn't that happen, right? Like, I start to ask the question, I'm like, well, hang on, how do I know you're right? Which is why most people need to go get second opinions on those kind of things. But so that's kind of where I'm at. It's got to be a balance between really, clinically valid predictive algorithms and AI, but not over-regulated to the point where you're never going to get these to be used in clinical practice.
Yeah. So, Andy, you and I have talked strategy over the years, and which I love. So when you're talking about in the role that you're in, thinking up use cases for AI in healthcare, when you introduce a product of any kind in any market, you have to assess the competitive field, right?
Sure.
You got to ask questions. Is there a product or service that currently solves a problem of your target market? And if so, how can we replace or displace, that service, through quality, price, whatever. But when we talk about innovative products that disrupt the system or change the game, that usually comes from outside the market, like Uber or TikTok or whatever. And that's because it saves money, it improves quality of life, offers new experiences, reduces friction, whatever. Let's think like short and long term with healthcare as it relates to AI products. What are some near term opportunities that you see for AI to either replace current products or services in the healthcare system that will improve our lives, and what do you see as downstream opportunities for AI to possibly disrupt healthcare?
I think in the short term, and you're right. I think with the advent of ChatGPT and that sort of going viral quickly and what's possible and all those kind of things, the challenge in healthcare is that just because something is technically possible doesn't mean anyone's going to adopt it or use it. Because, like, something can be very technically possible in the general world, and you can go buy it and subscribe $20 a month and get your ChatGPT or whatever. But in healthcare, again, all the same things we talked about. Is this valid? What's it doing? How does this work? And so, these models we've talked about, these predictive models that a doctor then makes a decision, relies on the AI and then makes a decision about, those are going to come over time. They're technically possible today. We can do these things. We can predict, HRD status from an H&E image. We can predict, whether a patient's going to be responsive to a certain kind of treatment just based on images, right? We can do that. It's technically possible today. But it's not really going to be adopted in clinical everyday practice for 5-10 years for a lot of reasons. What's really exciting today, and as patients you probably have seen this today, or maybe you go to your own doctors, like is the ability for AI to reduce the administrative burden on healthcare providers.
Mm,
Right? So
absolutely.
so you can see where large language models, hey, I'd like to record this and use an AI agent, great. So instead of your doctor staring at their laptop, firing away on the EMR and putting all the stuff into Epic, they're just having a conversation with you. Hey Rome, how you doing? How's the family? Hey, how's your shoulder? Okay, what happened? You working out again? You heard a pop? Okay, what did that sound like? Okay. You go through all that stuff, and then hey, I'm gonna prescribe you some medicine. Where's your pharmacy again? Okay, great. Okay, why don't you come back in 2 weeks? We'll take another look at it. All of that gets captured by the AI. All of that goes right into the clinical note. Your prescription got sent to your pharmacy the minute he said it. All of that stuff, and now that doctor, instead of spending 40 minutes later trying to remember that conversation you had, can go, yeah, that's exactly right, and click go, and now they're on their way. So I think reducing healthcare burnout is a huge issue, and so I think AI, that's going to be the immediate impact. That administrative burden, prior auths, something I know you love, near and dear to your heart, right? You trying to eliminate prior authorizations. How do you do better at that? Well, AI can start to do that, right? You can start to get into these worlds where maybe there's gold card messages. You already know certain things about the EMR. AI can extract that information, package it up, send that immediately to insurance provider, even while the patient's still in office. Get that authorization done when that patient's ready to get the treatment, right? So that there's not this weeks of administrative burden on an oncology staff, for example, to try to get a prior. So there's a lot of AI capabilities that I'm not saying going to replace anything, but maybe replace a lot of pain, which I think is how you get things going, and that's what we're seeing right now. I think in healthcare, a lot of these things like DAX by Nuance, Microsoft, which is this AI transcription tool. But I think too for patients, I think we're going to start to see things for patients. So at Tempest, we launched an app called Olivia, which is really all about patients having access to their own records and having AI help them with it. And you can also use that same app to do the same thing in your doctor's visit. Say, hey, doc, I'm also going to use an AI agent to help me with this. And so, you have a lot of people, doctor comes at you with a lot of big jargon, a lot of words, and like, oh my gosh, I don't know what he's talking about. All gets transcribed by the AI, and you can go back into that AI and ask AI questions. Hey, what did he mean by a BRCA mutation? I don't know what that is. AI will describe it to you. Hey, I don't really understand what he means by chemotherapy. What does that mean? And all of the AI can then help you understand that doctor's visit after your doctor's visit. So I think that's really the short-term thing is just reducing these terrible administrative burdens and really helping patients and doctors like come back to each other.
Yeah. Listen, I don't want to step over that. You just said a ton. Um, when we're talking about genetics, and a lot of times
Yeah.
these are a lot of clinicians
Yeah.
are not as well versed because they've been in practice for a number of years. The ability to detect genetic, mutations and aberrations
Yeah.
um, has, really increased in the last 10 years, even the
Yeah.
methods in which we are able to do that. So I've heard you say that our ability to use the information um, or
Yeah.
the let me rephrase that. So I've heard you say the information, the genetic information that is currently available and that it continues to come has far outpaced our ability to even manage it
Yeah.
and to
Yeah.
work with it. So
Yeah.
as you just mentioned, just
Yeah.
eliminating the
Yeah.
administrative burden that physicians have, and on the payer side, because I know for some patients it's their experience where there is a clear indication for either a drug or a procedure, but for some reason it's not approved, right? And
Yeah.
so you have to
Yeah.
play a game of telephone between your doctor's office and your health
Yeah.
plan to they ultimately approve it because somebody actually says, well, yeah, you should get it. Okay, let me
Yeah.
check a box here and make sure you get access to it. But that
Yeah.
could be months to get
Yeah.
the appropriate therapies um,
Yeah.
that you should be receiving upon your visit. And you're saying AI could really shrink that and create greater patient access to innovation.
100%. And I think we're already starting to see it. I mean, obviously there's I guess rightfully so, this sort of backlash at UHC and stuff, although the tragedy was terrible, with the CEO. But like, you think about AI agents talking to AI agents. So now you get this thing where you've got like AI agents on the phone with United Healthcare. They're happy to spend all day on the phone with you. Right?
Yeah.
You have to wait 5 hours to talk to somebody. Sure. I'm glad to, right? Like, so those AI agents don't get tired. We talked about that, and they go back and forth, and ultimately try to drive this forward. So it's like replacing the pain of a lot of the things that most healthcare providers, nurses, staff, like just hate, and patients too, right? I mean, nobody wants to hear from their doctor. Sorry, we're still talking to your insurance company. It might be 2 or 3 weeks or a month. Like that's not useful either. And so the way AI can start to help to really curate this information in a way that makes sense to all the parties, I believe will help to smooth the system out. Not completely. I think we're going to continue to have all of the friction involved in the healthcare payer system that we have in the United States, but it certainly can ease the burden on staff and in trying to get this stuff through.
Yeah. As you're talking to healthcare providers and about AI solutions,
Yeah.
how receptive are they? Because, one belief is that these solutions are going to replace people.
Right. Right.
What's been how
Yeah.
receptive are clinicians?
I think most people, think about doctors as all one class of people, but you and I both know, like there are emergency doctors, and there are oncologists, and there are surgeons, and there are pathologists, and everybody's good. It's a little bit different. It's a little bit different breed. Everybody's a little bit different, right, in the way they respond to things. And I think certainly the diagnosticians, these people like radiologists, pathologists, there was this famous saying from 6 years ago by this guy named Jeff Hinton, who said, all the radiologists in the world will be replaced by AI in 5 years or something like that. Right? And in fact, what has happened is that the pure amount of data and the number of MRIs and CT studies has tripled over the past 6 years. The number of radiologists has actually decreased, not because AI has replaced them, but because medical school students just haven't been turning them out as many. And
Mhm.
so what you now have is situations where radiologists are way overworked,
Yeah.
right? They're like brutally overworked around this. And so the conversation is not about, is it going to replace me? It's like, my gosh, where's the help? Right? I need the help. The idea that I could possibly spend and look at thousands of CT scans to look for the tiniest little dot that could possibly be cancer or possibly be some sort of glioblastoma or whatever. It's scary, right? And so, they really want AI tools that help, that solve the really, the things that are should be quick and easy and help them understand that and get through them. The hard things, their doctors, they'll work on. The same with pathologists. We were just trying to think about, hey, instead of counting cells on a slide, spend an hour and count the blue cells versus the brown cells. Like, let AI do that. Like, AI can do that, takes 10 seconds, right? And then you can
Yeah.
go on and really make the hard diagnosis. So I think the conversation has definitely shifted. Maybe 5 years ago it was that, oh my gosh, they're coming to take my job, to wow, I need the help. And I think we're only seeing how, cancer cases are going up, the population gets older, the amount of information continues to expand exponentially, but the number of doctors are generally going down, particularly after COVID and the pain everybody went through there. So it's really more about, like, they're ready for the help. And now it's like, okay, we talked about this earlier. Do I trust it?
Yeah.
And getting the docs to trust it. And of course, there's the economics to all of this too. But do they trust it? And that's where I think that's the phase of adoption we're at now.
Okay. Let's put a pin in this real quick. So you had a post on LinkedIn. By the way, follow him on LinkedIn, Andy Moye PhD. You will have that link to get in touch with him.
Yep.
But you had a great post on LinkedIn about from General Colin Powell
Yep.
about stop chasing perfection. And I
That's right.
thought that,
Yep.
first of all, I love, Leadership Secrets of Colin Powell. Yeah. You know,
Yeah.
but how much better does AI have to be more routinely used in
Right.
informing or making medical decisions? Because as you mentioned, there's some products that are already there. Right? So how
Yeah.
much better
Yeah.
does it have to be to gain the trust of clinicians and patients for it to be used routinely?
Yeah, this really is is the most challenging aspect of this. It kind of goes back to that conversation earlier, like if it makes me 10% better or 20% better or 30% better as a doctor, is it worth it? And I think we're starting to see where most doctors, it doesn't have to be perfect. Like it just, if it's supporting what I'm doing and it's making me a better than I would be at a baseline, I think we're starting to see adoption. And so, I think the days of, hey, it has to, 100% sensitivity, it has to get it right every time and no false positives and all these kind of things. These aren't it's not real, right? And no test, this, like in lab world, there's no actual test. Blood work, that's 100% sensitive, right? There's always
Right.
some, area that's not. So there's gonna be false positives, gonna be false negatives. These things are gonna exist. The AI, the technically continues to get better. And so I think it's really about, like, not expecting perfection. So let's get to it. Like, you have to iterate through this stuff. I mean, you have to get through some of these bumps in the road, in order to continue to refine these products and get them better. So, hopefully it's there. I think the real challenge, Rome, honestly, is I think doctors are somehow conceptually there. Most of them that get it, they want to trust it. It's the economics, right? Unfortunately, right? Like how, producers of AI algorithms, they obviously want to get paid for their investment in the data and the things that we do. But the hospitals and health systems, these things have to be paid for. And is the patient going to pay for them? Is the hospital going to pay for them? What economic advantage does it provide? Those kind of things. So I think that's really the next stage in adoption here. I think we're kind of through it has to be perfect or it's going to replace me. I think we're through that. Now it's more about, okay, what's the economic benefit to us, and how does it work in the workflow? Every day, it has to be easy to use. I think that's probably where we're at on the adoption curve.
Nice. When I have guests come on, whether they're patients or experts in the field like yourself, we love to ask for, ways that patients or their family
Yeah,
members can engage, right? Whatever
yeah,
the subject matter is. So,
yeah,
what are three ways that you feel that AI will transform healthcare, or
yeah,
specifically precision medicine through the use of genetics, that we can
yeah,
look forward to? And you've already talked about some near
yeah,
term things, but what are some ways that you're looking forward to, that our
yeah,
patients can actually track, that can really make a
yeah.
difference?
The first thing, particularly from a patient perspective, is this thing we touched on a little bit earlier. It's like demystifying a lot of this stuff that may be scary. You think about a newly diagnosed cancer patient, and particularly in this age, like my mom had breast cancer. It's been 35 plus years. God love her, and I don't know what kind it was, but they did a full radical mastectomy and just threw a bunch of chemo at it. And she's been, God love her, she's been cancer free ever since. But did they have to do that? Back then, they didn't know any better. They just did these things. And today, you're going to get a very complicated diagnosis of your cancer. Molecular subtype. If it's breast cancer, is it HER2 positive? Now, is it ultra low HER2? Is this something that I should be using the CDK4/6 inhibitor on? Is this ER positive? Like, now we need to look at whether I need to stay on, estrogen therapy or hormone therapy long term. It's a lot, right? And the number of places, like, just, and so now we have AI that can really help demystify a lot of this. And you've seen the Gemini commercials lately, from Google. You just talk to your Gemini and it's like helping you out. Like,
Yeah.
it's a little bit like that, right? That's here, right? You can do that with your healthcare. That's, again, like what Olivia sort of aims to do. That Tempest has brought out. It's like you have that doctor's visit, and then you can sit with the AI and ask the questions of the doctor's visit. Like, what did you mean? What does HER2 mean? Like, how does that impact my what's my prognosis? And so you can have that. So I think right now the ability to interact with AI and help demystify all of this really complex information, particularly genetic information, is the biggest boon to patients. Certainly, and we'll see that in the next couple of years. From the healthcare provider side, would also, maybe I'll stick to cancer for just a minute. From the healthcare provider side, man, the treatment options are exploding. I mean, this. I mean, every year more and more drugs get approved for different lines of therapy, and all it has to be third line after the first, second lines failed, and only if you gave these therapies. And like there's all these very complicated ways to treat your patient. But how do you know what you're doing is going to provide the best outcome? I think what we're really excited about at Tempest, and particularly with use of real world data, is being able to start to predict which types of therapies for the right type of patient are going to be the most effective. And that's what I think most healthcare providers are dying for, is this ability to, like, it's not just the genomic information, but it's like, okay, different treatment classes, different treatments based on different clinical information. We talked about the multimodal side of this. Now these healthcare providers, you get to a world where they kind of just talk to an interface and say, hey, here's what my patient has. Here's you read the clinical record. What do you recommend? And now you get this, hey, first line, the highest probability of success would be, the CDK4/6 inhibitor followed by XYZ. And in second line, if that fails, and now you're looking at probabilities based on real world data and real world evidence. It really informs the way. And obviously, this is a lot of the things that docs do today, but it's all manual,
Yeah.
through guidelines and protocols and stuff like that. But AI is really going to synthesize all that crazy information and help these docs understand which drug to give which patients. And then the last thing I'll touch on to hit three is on the drug development side. We work with, and I know you've worked with over the years, pharma companies. The challenge to get a really, really great drug to market is tough, right? Not only do you have to find a drug that's effective, that targets something that matters, that isn't toxic, right? It has to be well tolerated, and then it has to provide some actual benefit, right? It can't be a little bit of benefit over what's out there. It has to be a lot of benefit. And so using AI to find those type of really tough to drug targets, using AI to go through the real world data, understand which patients do respond, which ones don't. There's a lot of drugs that have been developed but shelved because they didn't make it through the clinical trial
Yeah.
process. Now we're going back and looking at those drugs with new eyes, right? AI can look at them and say, actually, this would have responded. Look at these patients. These patients did respond in your trial and they had this mutation. And that's, maybe you should go back and look at these type of patients. So there's a lot of ways. I think we're going to see an explosion, even though there's already been a giant expansion of these drugs out in the market. You're going to see explosion of precision medicines in the next 10 years, all from AI development.
And I think the most exciting thing about it is the impact on patient access to
Yeah.
these therapies.
Yeah.
Not only just eliminating the administrative burden to identify those cohort of patients when they at the point of care that might be
Yeah.
eligible for a test or a therapy,
Yep.
but also
Yeah.
the administrative burden from both the payer side and
Yeah.
also the healthcare system side to
Yep.
hopefully run these models that show like earlier access to these innovative therapies have the
Yeah.
great impact on financially improving outcomes
Yep.
as well.
Yep. Yeah. I mean, one last thing, at Tempest, we have a program called Next that's basically an AI derived agent that goes through the clinical record and is trying to find care gaps. And what I mean by care gaps is there's a lot of patients who fall through the system, to your point about access, right? A patient may not know to ask for a specific test.
That's right.
The doctor may not know to ask for a specific test, right? Based on something, and because there's just so much information. And so it's in the clinical record. The AI will come through there, look for different criteria and say, hey, actually, this patient might benefit from EGFR testing, for example. Send an email to that doctor and say, hey, you have a patient here based on these criteria, might need EGFR. And that's going to help to close some care gaps. AI can do that in a way that nobody else is going to do that. A human being come through these records and understand all the information that's necessary. So AI can really provide value to, also to your point, to get access to care that patients just wouldn't know to ask for. So that's also super exciting.
It is. It
Yeah.
is. Andy Moye, Senior Vice President, General Manager of Data Products for Tempest AI. Thank you for being a guest on Genetics for Healthcare.
Man, I appreciate it. It's good to see you, Rome. Take
Always.
care.
Now, hold on. Before I let you go, I wanted to double back on what we were talking about. Obviously, Andy is extremely humble, but I didn't know that, first of all, you're a naval officer and you were a pilot in the Navy, but I didn't know that you were deployed when 9/11 happened.
Yeah.
Um, tell us
Yeah.
tell us about that. I heard you share an interesting story
Yeah.
about that day.
we were deployed. People forget at the time we were sort of wrapping up. The United States was wrapping up this Bosnia Kosovo thing, and we were flying missions to sort of keep the peace in Bosnia and Kosovo. And so we were stationed in the Mediterranean, and just happened to be a day off, and I was in a crew-based aircraft, and so we were sort of just wandering around the exchange where you can buy stuff, and they had TVs there, and of course we're sitting there and we're looking at the TVs, and like everybody else, like, is that real? Did that plane just hit that building? Is that New York? And just everybody, remember everybody standing around in sort of disbelief, like this must be a fake, or what's happening, and at some point, I don't think it was me, but at some point, one of my crew was like, we probably should get back to base, it's probably something serious. And so we tried to get out of there, and the story is long, but basically we were on an Italian base, and our US base was like a couple miles away. Trying to get off the Italian base was not easy. Like, they were shutting the thing down, and people were
Yeah.
trying to, like, who are you and what's going on? And so we had to get back and kind of stood down for 3 or 4 days until we got new orders. What's happening here, and then the order was about the war on terror from there, and so, man, just crazy days. Everybody remembers where they were during 9/11, but that was where we were, and it hit home very quickly. Like, wow, we're going to be in this, and this is going to be something we're going to be involved in for some time.
Yeah. I think it's amazing, man, because that same, level of leadership and the fearless spirit you brought into the cancer diagnostics industry, and now you're leading, emerging strategies and bringing new products to the marketplace for, to improve patient lives. So, man, I
Yep.
appreciate everything you're doing, and I really appreciate you for being a guest on Genetics
Yeah,
for
man.
Healthcare.
I appreciate it, Ram. Yeah, it's great to be on the podcast. So I'm rooting for you.
Thank you. Thank you.